Should you do exercises if you've got lower back pain? Especially if you've tried exercises in the past and they've made your back pain worse, it can be tempting to think they're best left alone. But in the final analysis, is this the biggest mistake of all? If you're new here, welcome. I'm Michael Fatika, the lead osteopath and spine specialist here at Back in Shape, and we help people around the UK and all over the world fix their back pain and get back in shape for the long term. And in today's podcast, we're going to tell you what you should avoid, what you should do, and when to do it, so you know how to get your back pain fixed this time around. Firstly, when you have an injury to the lower back, it's no different to an ankle, no different to a knee. If you've damaged it, those tissues around the joint are going to be weaker, they're going to be more vulnerable and less able to protect that joint from further damage. We understand this very clearly. And with the lower back, if it's that L5-S1 disc that's herniated, giving you back pain and sciatica down the leg, it is absolutely no different. Healing needs to take place. When it comes to healing, we find it helpful to talk about two distinct parts of healing. The first is right at the time you've either injured it for the first instance or that you've flared that back up. And this is where there's tissue damage and we just need scab formation, we need scar tissue, we need collagen to go in there and patch that wound up to try and prevent further damage. This first part happens relatively quickly. We're talking about minutes, hours, days, etc. The second part, on the other hand, is the remodeling process. That's the reconstitution of that scar tissue, breaking it down, realigning the tissues, the structures along force lines so that we can get strength back into those tissue. In the case of a bone that was injured, we're talking about realigning those trabecular formations, the little lines that you can actually see on X-ray that transfer force through the length of the bone. In the case of ligaments, it's lining those collagen fibers up along the stress lines so that they can adequately do their job. Because having the fibers in a disorganized manner, like in that first part of healing, all over the place, isn't effective for weight bearing, etc. It's a temporary structure. We need to do that second part of healing to reorganize those and introduce those into the load bearing structure, whether it's the disc, the ligaments around there, or other structures that you might injure in other areas. The thing with this second part of healing is that often it can take place when symptoms aren't necessarily so bad, but it requires two important things. Number one, it requires time. Instead of days, minutes, and hours, it's going to take weeks and months for this process to take place. And we could argue that it never finishes because it is going to be, at the end of this, a very dynamic process. You can make them even stronger than they were before, or you can stop part way. It's really down to you providing that stimulation. And this is where exercises are going to come in. However, if we do the wrong sort of things or too much at the wrong time with improper technique, etc., we're going to find that too much stimulation will result in re-aggravation of tissues that just weren't ready for it, and that's when flare-ups can happen. Given that this second part of healing takes place over a longer period of time and that your symptoms might actually be a lot less from moment to moment, it's very common that at this time, people make the biggest mistake of them all when it comes to aggravating and flaring up and interrupting that healing process. Granted, there are going to be many exercises that we've talked about on the channel, things like knee hugs, child's pose, forward bending, etc. You can find links to some of those, such as a child's pose video and a knee hugs video in the link below. Those exercises are just wrong. We don't want to do those and we won't discuss those in this video. You can check that out in the description if you're interested in those. But once we can remove the presence of bad exercises, this mistake is the way in which we use our body. It's the fact that we'll be very worried about doing proper exercises to help the resistance process, yet every single day we're playing with the grandkids on the floor, we're picking our kids up to put them in the car seat, where maybe if we've got a newborn child, we're going to be putting them in the cot, rounding our lower back, we're going to be doing the laundry, we're going to be carrying the shopping, we might be doing some gardening. All of these things are putting unbridled strain on that area of the lower back that's trying to go through that second phase of the recovery process, of the healing process. Yet in the same breath, where they're going, oh gosh, I can't do exercises because it might make my back worse. I tried exercises and it made my back worse. This mismatch in terms of how we're treating the exercises is some very scary thing, yet in the same breath doing all these other things every day is a real factor that stops people getting better and is by far the biggest mistake. It's how we view these two things, daily life activities and the exercises. Because in the vast majority of cases, there are exercises we can do, which we'll talk about in a moment, that will replicate those daily life activities that you can do in a 100% focused environment with 100% concentration and no distractions. Yet we're going to do that same movement. A great example here is the squat. When we're doing a bunch of other things around the house, sitting down to get in the car, sitting down or getting out of a car seat, sitting down at the dinner table, bending down to pick up, the little one off the floor or pick up the laundry. Those are all types of squats, yet we're doing them whilst we're focusing on 101 other things during the day, and we're worried about doing a formalized squat, but we still do those other things, and it makes absolutely no sense, and it's a massive area that stops you getting better. So as you probably guessed, exercise is the right way forward. It's going to help you fix your lower back pain if you do it properly. And there's a very simple way that you can approach exercises to make sure they are effective for you. And this is proper exercise performed with the proper technique, without any errors, for a consistent period of time with sufficient resistance to challenge your body over many weeks, months, and years. That's all you have to do. And if you do that correctly, yes, when you're learning the technique and how to do it properly, you might make some errors, and that's understandable. But you're making those errors anyway when you're doing all those other activities I mentioned. So there is a little bit of humility required here. You might not be able to do some of these right. And that's why we've got videos on the YouTube channel and on the website, such as the tape test, to help you start to get a better understanding of how you're holding or not holding your spine when you're doing things like the squat, and therefore by extension, sitting down in a chair, etc. There are resources such as videos on the hip hinge, which is a fantastic exercise you can do to start to build strength in your lower back, such as the step up, which is a great one if you've got weak legs or problems with your hips and knees, which are affecting the lower back as well, such as the dead bug and marching bridges. All of these, again, are linked down in the description to help you. I won't cover them all here on this video. You can check out the one you're most interested right after this video. But they are step-by-step tutorials to learn to do the exercises correctly. Know that if you could do them all correctly at their highest level, in terms of greatest difficulty, you wouldn't have the problem that you have now. And we need to understand that the only way to actually incorporate exercise safely and effectively is to be willing to learn, follow something that makes sense, and find the most difficult variation you can do without aggravating the pain, and that's where you start. And if you do that correctly, you will leverage a fantastic tool, exercise, to really rebuild your lower back for the long term. That's how you get out of pain, fix your back pain, help that herniated disc or injury in your lower back actually strengthen back up again, reintegrate into the rest of the lumbar spine, so you have a healthy lower back that can do stuff, the stuff that you want to do. In addition to those tutorials, we've got two final resources to really help you. Number one is the full 80-minute masterclass. That's going to talk you through a bunch of theory stuff, much more detail than what I've explained here in this video. It's also going to go through the exercises that I've touched on and how to do those in order over time. Really, really helpful resource. As I said, it's been used by many, many people to really help get them started. And then the second process is going to be the membership to the Back in Shape program. That's where we go through the full phases, phase 1, 2, 3, 4, and help you do that effectively with the team here to make sure that you have everything you need to make this a success. So you're not going around in circles doing the wrong things, struggling with relapses, struggling with technique. You've got everything you need to fix this once and for all. Hopefully, if you made it this far through the video, you have found this one helpful. You've got a new perspective on how exercises can work for you. You're starting to more appropriately think about exercises versus activities of daily living, and thinking, actually, those are probably way worse than the exercises that I'm doing in almost all cases. And as always, if you've got any questions on what we've discussed today, please do post those in the comments below. We read and reply to all of those, and they help us make more content just like this to help you more. So thank you so much for watching this far. We'll see you in the next video.